Thank you very much for the introduction. I'm thankful to the organizers for the invitation to speak at the 10th Furhat Conference on Social Robotics. It is honor and pleasure to be here among renowned researchers and practitioners exploring the future of real-world human-robot interactions. My name is Paulina Tsvetkova. I work at the Institute of Robotics, Bulgarian Academy of Sciences. In my work, I focus on the intersection of artificial intelligence, psychology and social robotics, with a particular interest in how social robots like Furhat can support mental health and rehabilitation. Today, I would like to share with you some of our experiences and case studies, exploring how Furhat may help create more engaging, supportive, and human-centered therapeutic interactions. According to a World Health Organization report from the last year, 31 countries in the European region have committed to integrating mental health into all areas of public policy in response to a growing mental health crisis, affecting 17% of the population. The report highlights alarming trends, including 1 in 6 people with a mental health condition, over 120,000 suicide deaths annually. Suicide being the leading cause of death among people aged 15-29, and major gaps in access to care, with 1 in 3 people with mental health conditions not receiving needed treatment. World Health Organization also warns about increasing loneliness, problematic social media use among adolescents, and a severe shortage of mental health professionals, calling for urgent cross-sector action to promote mental well-being. Equally alarming is the growing burden of stroke. Again, according to the World Health Organization data, stroke was the third leading cause of death and disability worldwide in 2021, affecting an estimated 93.8 million people and causing 11.9 million new cases that year alone. The lifetime risk of stroke has increased by 50% over the last 2 decades, with 1 in 4 adults expected to experience a stroke in their lifetime. As mental health conditions and stroke rates continue to rise worldwide, healthcare systems are facing increasing pressure to provide continuous emotional support and long-term rehabilitation, particularly amid aging populations and shortages of trained professionals. Although digital health technologies improve access to care, patients often disengage when interactions lack emotional connection and social presence. This creates a growing need for support systems that are not only scalable, but also emotionally engaging and socially responsive. In this context, social robots represent a promising new direction in healthcare by serving as embodied, expressive, and relational care companions that can motivate, comfort, and socially engage patients in ways traditional digital tools cannot. As someone working at the intersection of artificial intelligence, psychology, and social robotics, I'm especially interested in how Furhat can be designed not as a replacement for psychologists, but as an assistive tool that supports psychological practice through structured, engaging, and non-judgmental interaction. So me and my team developed the Furhat skill for administering psychological questionnaires. In this case study, I used the DAS21 tool for measuring depression, anxiety, and stress. It was a pilot study, so I reached to 10 young people in our country aged between 19 and 30. I made 2 analyses, quantitative analysis via the robotic social attribute scale, which measures perceptions of warmth, competence, and discomfort. And I also made a qualitative analysis through in-person interviews with the participants to measure trust and engagement additionally. The mean scores across the three Rosas dimensions, warmth, competence, and discomfort, indicated that the participants rated the robot highly on competence and warmth, as you can see, both about the neutral midpoint of 4. On the other hand, discomfort received a low mean score, suggesting that the young adults tended to evaluate Furhat as more competent and friendly than discomforting. Regarding the qualitative analysis, I conducted it to explore the respondents' feedback and to obtain a better idea of their interaction with the robot. The young adults responded to a couple of open-ended questions such as, did you feel engaged during the interaction with the robot? Will you trust the robot to administer another questionnaire to you? What aspects of the robot's behavior and appearance did you dislike? And also, do you have any suggestions for improving the robot or its interaction style? All participants reported feeling engaged and admitted they enjoyed interacting with the robot. They characterized their interaction as pleasant and interesting. The respondents emphasized that the robot's calm voice and not judgmental manner helped them feel at ease and contributed to their willingness to respond openly to the DAS21 items. Some individual differences were also reflected in the responses. One participant, a female, noted that she still felt some prejudice about speaking to a machine rather than a person, which prevented her from fully confiding in it. Another respondent mentioned that sharing a difficult situation with the robot could be easier than talking to a psychologist because she wouldn't feel evaluated or ashamed. Very interesting observation, actually. Overall, the participants' descriptions of the robot as approachable appeared to encourage openness during the screening. Evidence suggests that home-based stroke rehabilitation significantly improves recovery. Despite that, maintaining long-term patient engagement remains a major challenge. AI-driven embodied conversational agents offer a promising solution by providing personalized guidance, motivation, and support throughout the rehabilitation process. However, real patient testing is often limited by practical or ethical constraints. To address this, we proposed a co-AI design-based research approach for iterative development and evaluation of embodied conversational agents using synthetic patients to simulate and refine interactions. The approach was further validated through pilot testing of the Furhat robot with patients' relatives and rehabilitation professionals to validate the method in a post-stroke rehabilitation context. Our study aimed to explore the potential of the social robot Furhat to support stroke rehabilitation through conversational AI and socially assistive interaction. The evaluation involved 15 participants, including 9 rehabilitation professionals and 6 family members of stroke survivors. The findings demonstrated high usability and engagement, with participants perceiving Furhat as supportive, reliable, and easy to interact with. Conversations were described as natural and less repetitive, and no factual inconsistencies were identified in the robot's responses. Family members of stroke survivors showed particularly strong acceptance of the system, highlighting the potential of social robots in a home-based rehabilitation context. And now I would like to finish with a short video which demonstrates how Furhat can support home-based rehabilitation interactions.
Направете 10 повторения. Това укрепва устните за по-ясен говор. По-късно движете езика. Изплезете го далеч. Движете наляво, надясно, нагоре, надолу. 5 повторения за всяка посока. А. И. У. Поемете дълбоко въздух.
So that was from me. Thank you for your attention.
Okay, so thank you so much, Paulina, for your talk. Your presentation highlighted some incredibly important implications of social robotics in healthcare and rehabilitation, especially in areas where empathy, accessibility, and engagement are essential. And before we get to the audience questions, I want just I thought about the question during the during your talk, and I wanted to discuss it with you. So there was one very interesting observation from one of the studies, and it was about that one of the users said she preferred to talk to a robot rather than a human to not feel judged. So I want, because you just mentioned it, but I want to know your view on this matter.
Okay, so first, people often fear being judged when discussing sensitive emotions, trauma, anxiety, or mental health symptoms with the clinician, psychologist. Uh, and Furhat, as a social robot, delivers questions in neutral and consistent tone, which can reduce the perception of criticism or emotional evaluation. So lower defensiveness or embarrassment, encouraging people to answer more honestly. On the other hand, foreheads help reduce stress and social pressure. People often unintentionally convey impatience, surprise, or concern through facial expressions, tone, or body language. Also, the robot's not judgmental, emotional comfort and trust. And finally, as human-like but emotionally neutral presence may help people feel engaged without feeling overwhelmed. And I think these are the reasons why this person admitted this.
Okay, this is very interesting, honestly, because I didn't think that so soon people would actually start preferring having this. And related to my earlier question, we have one of the participants, one of the audience. He's saying, "Hi, how do you control the credibility or safety ethical requirement of the robot's output for this kind of user?" So how do you control the credibility of such an important matter, especially in social robotics?
So here at the Institute of Robotics, we have an ethical committee, and every time when we conduct sessions with people, we have an ethical improvement and informed consent of the participants. We require such consent from them, and after that, we proceed with the real experiments and sessions with the people, with the participants.
Yes, this is great that we have this, but I think he's also trying to ask about the robot's output, like the ethical requirement of the robot's output.
Um, so me as a psychologist uh, can detect if the robot's output is ethical or not, and uh, we always test this. Before real experiments, test the output of the robot, and after that we proceed with the real experiments.
Okay, this makes more sense. And then we have another participant. He's thanking you first for sharing your research and for this talk. And then he's asking, any insights into the physical preference over an avatar on the screen?
We, in our experiments, we found out that people we often prefer a real robot to avatar, uh, namely because of appearance, its capabilities, its facial expressions and tone, and this is always more engaging to people when they talk to the real robot than to the avatar.
Yeah. Personally, I also like I've been on both sides of this. I've been a user of or like as a user in a study. I would prefer dealing with a real robot, and when also making an experiment, I also prefer having a real robot. So yeah, this makes
Yeah.
perfect sense. And now we have one more question. It's a longer question, so we'll go through it. So our participant says, I have a paper about a psychologist chatbot. In our study, we involved human psychologists to measure users' depression levels. I agree that these chatbots or robots can be helpful because users may feel less judged. I think this is related to what we were saying earlier. And these systems can support people in reducing mild depression. However, for people with severe depression, constantly agreeing with or validating the user in every situation could make the condition worse. What solution would you suggest for this problem? This is a very deep and a very strong question. So.
Yes, sorry, can you repeat again the question itself?
I can tell you my understanding of the question because it's a very long question. So he's saying that even though the presence of robots and chatbots can be helpful, but only in certain cases of mild depression. But in cases of severe depression, if the chatbot or the robot always agrees or always validates the user, whatever the user is saying, his situation, this could even make the situation worse. So he's asking,
Uh,
what do you suggest for this problem?
yes, very deep question, actually.
Yes.
Interesting. Um, Actually, the design of the scenarios with the robot should be carefully created through the help of psychologists because they know what exactly the person needs, the patient or the person they support and they help. And each individual has specific needs. And when the robot, in this case, always agrees, the person dealing with as something which can help him or her. And the scenarios should be designed in such a way that they adapt to every person needs, to each personal needs.
Adapt personally, that would be the solution.
Yes, I think so.
Okay. And also, this is coming from a psychologist, not only social robotics. So I think it's good to go. So that was our last question.
Yes.
We do have more questions, but for our time, we're very, very happy to have you today here with us, Paulina. And thank you so much once again for your presentation and for your answers.
Thank you very much for the invitation and for everything.
See you.
See you.